Hello everybody, Dr. Mark here, and today I want to talk to you about how serious your dog's broken nail can be and what you can do about it at home. Unfortunately, we see this way too often when guillotine-type clippers are used and the dog jerks his or her foot at the wrong moment. I prefer everyone use rotary Dremel-type tools. They are inexpensive and a tool costs as little as one nail clipping at your local veterinary clinic. If your dog does jerk his foot when you cut and starts bleeding, the first thing you need to do is take care of it with basic first aid. Before you get started though, you need to muzzle your dog. Yes, I can hear already, since most people say, "Not my dog," and tell me that their dog would never bite. That is until he or she bites. Broken toe nails are painful, a lot more so than most dogs are used to, and a dog in pain often reacts differently than we expect. If you do not have a muzzle at home, all you need to do is make a homemade muzzle from a roll of gauze. There are plenty of good videos on YouTube that will show you how to do that. After your dog is muzzled, you first need to stop the bleeding. Hold the paw up, over the level of the heart, and wrap a washcloth or hand towel around the paw so that you can apply a light pressure to the bleeding nail. If this is not enough, you may need a styptic pencil, and if you have a dog, this is something you should have in your emergency first aid kit. If the bleeding does not stop after 10 to 15 minutes, there is the possibility that he has a bleeding disease and will need to be seen by your local vet. After the bleeding is under control, clean the wound. The best thing to clean a wound with is sterile saline, but even tap water is okay as long as you use enough. Remove the dried blood and any dirt that is clinging to the wound. Be sure to remove any hanging piece. This will not always be necessary, but some dogs will break a nail and it will still be semi-attached. Every time the dog walks, it comes loose and he will be in pain, so after you have cleaned it up, check and remove any hanging piece with nail clippers. Now just apply an ointment to keep it moist. You can use a triple antibiotic ointment, although your dog may lick it off, or just use coconut oil. This is much better than putting on any triple antibiotic ointment you already have. Coconut oil has some antibacterial effects and will not upset your dog's bowels if he licks it off. Finish up by bandaging the wound. This may or may not be necessary, and some dogs will not even keep a bandage on the paw. If you take your dog to the vet, they may decide to wrap the foot to keep the dirt out of the wound. If you cannot wrap your dog's foot in gauze and do not have any vet wrap, a child sock works great if you just need a temporary cover for when your dog is going outside. After bandaging, you should still be able to see two toes. Take a good look at them as they are parallel. If you look at them a few hours later and they have moved apart, the bandage is too tight and the foot is swollen. Take the bandage off since the foot does not have blood flow. If the bleeding stops and you are able to keep the wound clean, you do not need to take your dog to the vet. Your dog does not need antibiotics for a broken nail. If the nails that are not broken appear abnormal, such as being split or discolored and crumbly, then it is possible your dog has a bacterial or fungal infection or a disease such as symmetrical lupoid onychodystrophy that is making his nails weak. Dogs with this problem usually lick at the foot even before a nail break, and this disease is usually seen in young and middle-aged dogs and is most commonly seen in English and Gordon setters, German shepherds, Akitas, and some others. If your dog does not have abnormal-looking nails and has not been licking them excessively, there is probably nothing to worry about. Just go ahead with the treatment suggested above and the nail should regrow normally. If it does not regrow and if it is still bothering the dog, in about a month you will definitely need to take him in for an exam.
Thanks for watching. If you want to learn more about this, you can read my articles at pethelpful.com or go to my Ask a Vet column at that site. If you found this information helpful, please like this video, and if you want to learn more health information for your dog, you can subscribe.